Hello, I'm Diane Webster, and today's story is called Dying to See. It's based on true events, but names have been changed. Dying to See, Mackay, Queensland, May 1997. 7:30 a.m. Tim dropped me off at the staff entrance of the hospital. I had a full list of operating ahead. 25 cataract surgeries to do. We should be finished by 3 or 3:30 p.m. Richard and Patrick were in the car with Tim. It was a special day today, Patrick's 5th birthday. Tim said, "Hope everything goes well today, Di. I'll be back to pick you up at around 3. As I was getting out of the car, Patrick called out, "Can you bake me a cake today, Mum, for my birthday?" "I'll see what I can do," I replied, waving goodbye and thinking to myself, now that is not going to happen. Unfortunately, I'm thinking I'm not Superwoman, I have a husband and 2 small boys aged 6 and 5. Yesterday, I had operated a full list of cataracts, and I was following up with another full list today, Saturday. How on earth could I bake a birthday cake as well for my little Patrick? I saw him smiling at me as they drove away with such innocent, happy expectation in his gaze. In the operating theatre, as I was putting on my gown and gloves, I told the 2 nurses my son's request for me to bake him a birthday cake today. We all chuckled about the impossibility of that happening. My anaesthetist, Jim Baker, came in at that very moment, but looking very pale and drawn and saying, "Mr. Somerville, 5th on our list this afternoon, has died in the ward. Remember him from yesterday? You did his first eye and all went well. I went to see him this morning in the ward for his pre-op check for the second eye, and the nurses told me he'd arrested. Looks like he choked on his cornflakes around 6:30 a.m. and couldn't be resuscitated." We started the list and everyone was very subdued. It was a shock. We routinely operated on patients' cataracts, doing one eye on the first operating day and the second eye on the next day, to reduce travelling time for our patients. Mackay is a very large regional centre in Queensland, and many patients travel over 100 kilometres or more to have their cataract surgeries performed. The list was going very smoothly until Mr. Cooper. He was 80 years old and on medication for high blood pressure and cholesterol, with a past history of heart disease. These conditions, unfortunately, were all the norm for this group of patients having cataract surgery. The operation was going well until Mr. Cooper started to cough. I immediately removed my delicate microsurgical instruments from his eye. "Mr. Cooper, please don't cough if you can help it. When you cough, you move your head, and it's very difficult for me to continue with your cataract surgery," I said. All our patients were operated under local anaesthetic with some mild sedation from the anaesthetist, and they were kept very comfortable, and they could usually hear everything I was saying to them. I resumed the surgery, which, thank goodness, was nearly completed. Mr. Cooper kept coughing, however. There was nothing I could say that made any difference. Jim Baker, my anaesthetist, listened to his chest with a stethoscope, and I knew things were not going well now. "His lungs are full of fluid," Jim said quietly. "Pulmonary edema. I think he's had a silent infarct." Oh my God, I'm thinking. This has never happened before when I've been operating. I've got to finish this surgery in record time, lightning speed, so we can resuscitate him. "You've got to stop operating now," Jim said authoritatively. These were words I did not want to hear. At that very moment, I could imagine if I did stop before I had inserted the intraocular lens, with the eye still full of cortex, tomorrow the eye would be terribly inflamed and I wouldn't be able to go back to fix it because the patient would be unfit for surgery for probably weeks after this, and maybe would lose the sight of his eye because of it. Of course, if I didn't stop operating now, poor Mr. Cooper might arrest on the table and die, which would be far worse. Time seemed to slow down. I was able to remove the cortex and insert the intraocular lens within 30 seconds. To me, the surgeon, it seemed much longer. I secured the wound, injected antibiotics into the anterior chamber to prevent infection, and placed the eye shield over Mr. Cooper's eye. I then replied to Jim, "We're done." Jim immediately started the resuscitation, and in record time, we had Mr. Cooper stabilised and safely transported up to the coronary care unit of the hospital to make a successful recovery. I was relieved because I imagined going to see Mr. Cooper in the ward tomorrow, Sunday, and how beautiful his operated eye would look. Perfect, in fact. But it was hard to continue the list with the remaining patients. I suddenly felt very tired, probably from all the energy exerted to complete the surgery in the record time, and the adrenaline rush was waning now. We still had 15 more surgeries to go. My job was to remain cool, calm, and collected for the staff and patients, even though inside I was exhausted by what had just happened. The remainder of the list went perfectly well, thank goodness. In the change rooms, as I was gathering up my belongings to go out to the car where Tim was waiting to collect me, one of the ladies from the hospital kitchen came in and presented me with a beautiful homemade birthday cake for my son Patrick. The nurses must have told them, I thought. Out at the car, Tim, Richard and Patrick were all smiles to see me. We were off back home to celebrate Patrick's birthday. "Thanks, Mum," Patrick said with a big smile when he saw me carrying the cake. "Thanks for baking me a cake today." That's the end of the story. Thanks for listening. For more stories, head to my YouTube channel at Dr. Diane Leslie Webster. Until next time.